There's a large body of research, and it's a global body of research, that indicates that exposure to discrimination, both kind of virulent forms, but even little indignities on a day-to-day basis, has pervasive adverse negative effects on health. There's studies showing an increase in the risk of premature death linked to exposure to discrimination. What the research is also showing us that is very relevant for our conversation, that it's not just the incidents that are targeted at you individually, but if you live in a community with higher levels of prejudice. Studies show African Americans who live in such communities across the United States, such counties across the United States, have higher rates of death. It's not just African Americans. There's a study looking at anti-gay prejudice in the United States. And for LGBT populations who live in communities of higher anti-gay prejudice, their death rates are 3 times higher than those who live in communities of low levels of anti-gay prejudice. And this is pervasive throughout society. One of the studies I was involved with documented that among high school and middle school students who are exposed to racial discrimination in online contexts, their levels of anxiety, their levels of depression are higher even after you take into account other adolescent stressors and discrimination offline. So documenting that discrimination online is a unique contributor to their poor health.